So thank you for giving me permission to teach you today about birth control and telling me some of the things that you do know about it and some of the things that you might not know about it. And you know that there's some that protect against STDs. Those would be your barrier contraceptives, and then there's some that don't, and they're specifically designed just to prevent pregnancy. And there are some that deliver hormones. Some are estrogen and progestin. Some of them have no estrogen. So it sounds like you were most interested in the one, the IUD, specifically the Mirena or the Kyleena IUD, which is the one that delivers the progestin hormone. So there's different ones that deliver different amounts, and so that'll just depend on how much we feel like you need hormone-wise. This is a very effective long-term birth control. So it's a little T-shaped device that will be inserted in the clinic by a licensed provider, and they will put that in there, and it'll sit right in your uterus, and it'll last for 5 years. So that's really good. And the other thing that's really good about it is that once you remove it, you can resume normal fertility. A lot of women also really like this because it can regulate their menstrual cycle. It can also sometimes eliminate or really shorten the menstrual cycle altogether. When you first have it in, because of the rush of hormones, there will be some, breakthrough intermittent bleeding, might be a little heavy at times, but if you notice that happening really often, make sure you come to the clinic or call the physician. So specifically, like I said, this one prevents the pregnancy and does not protect you against STIs. So what you want to do is, if when you have it in, after you have it in, you have that little T-shaped device. There's these little strings, which are cut by the person who inserts it. You want to make sure that you feel them, but they shouldn't be uncomfortable. So if you find that you're having intercourse with your partner and they're feeling it a lot, maybe you can come in and have them trimmed. It's always an option. And if you don't feel them, you might want to come in also, and we can just take a look and maybe pull it back, because sometimes it can travel. We can also take it out and put in a whole new one if it's kind of traveled a little bit too far up. So some risks with this: because of the hormones, you can have increased risk of headaches, some acne, breast tenderness. Like I said, you might have some irregular periods. Because of the hormone, you're also going to have mood changes. You might have a little bit of pelvic cramping. And some of the things that might need to have the IUD removed is if you develop some kind of an infection. You have a really lot of heavy bleeding, or if you feel like you may have gotten an STD, if you have multiple partners, that would be a risk factor between having a device that's in there that can harbor bacteria. You also can, you want to tell us if you have pain with intercourse, if you get really severe migraines that aren't going away, if you have an increased risk in your blood pressure, if you've ever had a stroke, this might not be for you. If you've ever had a heart attack, this might not be for you, or if you think that in the past you've been exposed to an STD or an STI. So this is all the things about an IUD, a Mirena IUD or Kyleena, whichever one. Like I said, different forms of amounts of hormone being released. Long term, fairly simple procedure, done in the office, very little downtime. You can resume normal activity for the rest of the day, and just be aware of the signs and symptoms that I told you about. So there you go.